I really wanted to take the opportunity to draw attention to a massive unfolding crisis in the northeast of Nigeria that's getting very, very little media coverage at the moment, and virtually nobody is really aware that this is taking place here. Up to at least 500,000 people, that's 500,000 people, are right now in desperate need of emergency humanitarian assistance. They need food, they need water, they need shelter, and they need emergency medical care. Now, what's happened is that the conflict has been raging in this region for quite some time. Some communities have been entirely shut off for up to 2 years. And that means that they're entirely dependent on assistance, on aid. MSF is calling for a massive mobilization in response to this catastrophe. Currently, what's reaching people in need on the ground is entirely inadequate. It's only through a giant scale-up of agencies providing emergency humanitarian aid can we really try and tackle and address this problem. There's been a huge loss of life, people dying as a result of this isolation. We saw up to 15% of children screened in communities having severe acute malnutrition. The other impact, clearly, is that people are now on the move. Now that the security has been established in some of these regions, people are moving, and they're moving in en masse to the bigger cities. So primarily in Maiduguri, we're seeing a huge influx of people, and this is completely overwhelming the city hospitals. They're unable to cope with the numbers of people that are seeking medical attention in the city, and this is a massive priority for us. In addition, wherever you see large populations, people on the move, people living in very unstable and insecure environments, we have the risk clearly of infectious disease. Already we're dealing with an outbreak, an epidemic of measles. So we need to move, and we need to move fast if we're going to contain this problem.